Good afternoon. Caitlin, Rhiannon, Sarah, Vaish and I will be presenting our research on the alternative health benefit, foot reflexology. To start, I will be providing a brief background of foot reflexology. Alternative and complementary medicine are widely used as a substitute to conventional medical treatment, most of which are used to improve the symptoms of diseases and pains. Foot reflexology is a mixture of art and science, which targets the body's natural healing abilities. It is based upon the theory that the body is reflected on the feet, and in applying pressure to these exact locations using various massage techniques, a range of conditions can be treated and relieved, including headaches, dementia, and cancer-related pains. Prior to its modern use, it has been claimed that reflexology practices started in ancient Egypt, Tibet, China, and with Native American Indians. However, there lacks proof that confirms such evidence depicts the application of reflexology, such as the following image of an Egyptian tomb painting. A branch of reflexology is believed to have originated with the Taoism religion, a Chinese philosophy which emphasizes living in harmony with Tao, the absolute principle underlying the universe. Tao energy currents, or meridians, run through the body in a balance of yin and yang, which may be disturbed by stress or illness. This alternative therapy can be divided into Western and Chinese reflexology. Western reflexology focuses on body relaxation and is based on zone therapy, a theory accredited to Dr. William Fitzgerald, who published his work in 1917. His theory describes that there are 10 vertical zones in the body, and by stimulating the appropriate locations on the soles of the feet, bioelectrical energy flows could be altered, leading to pain relief in corresponding body regions. Conversely, traditional Chinese reflexology stimulates and energizes the body. It divides the body into 12 energy meridians, as mentioned before, with the feet containing controlling buttons. Kneading on them can bring about change in the flow of energy to the entire body. When the flow in one meridian is blocked, the entire body suffers. So manipulating these points releases the flow, allowing the body to recuperate and heal on its own. Sarah will now continue by introducing some of the evidence, arguments, and ethical issues surrounding foot reflexology.
From 10 systematic reviews, it is safe to conclude that there is sufficient evidence to support the clinical uses of foot reflexology. Certain conditions patients may have can hinder their ability to take part in foot reflexology treatments, as it will give adverse effects. These include localized skin disease at hands, feet, and ears, diarrhea and vomiting, and localized inflammation or swelling of the feet, hand, and ears. Recent theories have been hypothesized to add new layers of understanding and evidence regarding the true purposes of foot reflexology. There are 5 theories that support how reflexology gives impacts to the human body. First and second basic theories are related to energy. The energy theory advocates that body parts can communicate using electromagnetic fields, and the communication can be blocked based on the surrounding respectively. Third and fourth theories indicates that energy flow can be restored, and the fourth is about the pathway which is blocked and can be opened. The last theory proposes that foot reflexology can break up the lactic acid crystals that are usually deposited in the feet and allow energy to flow efficiently. It has been suggested by a Swiss study that patients who have undergone reflexology sessions showed a significant decrease in the amount of medication required. The recent increased demand for evidence-based practice challenges the researchers to provide a relevant but holistic assessment of reflexology. Despite the recent vast use of reflexology, minimal attention has been given to the ethical issues related to the research on foot reflexology. In the view of public health and safety, we argue that the research on reflexology should adhere to the same ethical requirements for all clinical research. The proper design, control, and intervention protocols of research on reflexology remain debatable. The use of randomized controlled trials is the golden standard in assessing the efficiency of complementary therapies such as reflexology. Verhoeven has described the challenges when researching and finding sufficient evidence for complementary therapies such as foot reflexology. Standardization of treatment that limit the individual of receiving ongoing treatment, clients focused on health with restricted roles for disease treatment, ethical issues involving the recruitment and randomization due to participants' preconceived beliefs on reflexology, practicality of applying reflexology, and the interference of psychological influences on rapport between the patient and the provider. Therefore, it can be safely assumed that more evidence needs to be gathered in order to determine whether foot reflexology is an appropriate alternative health care. I will now pass on to Caitlin, who will be discussing whether or not foot reflexology clashes or complements traditional medicine.
Can foot reflexology be used in conjunction with traditional medicine to treat diseases and ailments? Studies found that while it could not heal diseases by itself, it can be used to complement an evidence-based approach, often by decreasing stress and anxiety levels. One study looked at the effects of foot reflexology on the anxiety levels of children undergoing chemotherapy treatment. Chemotherapy is an important and effective cancer treatment, but often causes high anxiety and stress levels as it is injected, thus a suitable vein has to be found, which is not always easy. Some side effects of chemotherapy include an increased heart rate and blood pressure, meaning that it can be beneficial for the patient to be relaxed and calm before the treatment is administered. In the study conducted, foot reflexology was shown to have a significant effect on the children, as both heart rate and anxiety levels decreased, even after being injected. On the other hand, the anxiety levels of the control group were shown to increase. The researchers also believed that by being relaxed during treatment, it would lead to a better response. Additionally, this would also improve the mental health of these children, although it was not tested in the study. In this way, foot reflexology complements chemotherapy by reducing anxiety levels of the children, thus improving their mental well-being. Another study researched the effects of foot reflexology on anxiety levels of women in labor. High anxiety levels during labor has been proven to have negative effects on both mother and child, leading to long-term problems such as postpartum depression and inadequate mother-infant attachment. High anxiety can also prolong labor and cause more pain due to decreasing endorphin and oxytocin release. The study found that by administering foot reflexology during labor, anxiety levels decreased, both during and after giving birth. In comparison, the control group experienced significantly higher levels of anxiety. Therefore, foot reflexology complements the traditional method of giving birth by relaxing the mother as well as preventing future problems that may arise due to high anxiety levels.
Case Study 3 examines the effectiveness of foot reflexology and back massage on enhancing the sleep quality and reducing the fatigue on hemodialysis patients. Hemodialysis is a treatment that filters waste and water from your blood, removes extra fluid, and balances electrolytes. During this process, it has been reported that between 50 and 83% of hemodialysis patients experience sleep disorders, and between 7 and 92.5% experience fatigue. This is due to a variety of reasons, including accumulation of metabolic waste, fluid electrolyte imbalances, depression, and anemia. In the study, a pretest was taken on the patients immediately before they received hemodialysis. The patients were divided into 3 groups: foot reflexology group, who received foot reflexology sessions 2 days a week, a back massage group who received back massages for 2 days a week, and a control group who received neither. After a period of 4 weeks, a post-test was then administered. The results indicate that both methods reduce the patient's fatigue and increase their energy and sleep quality. However, foot reflexology was found to be the most effective. Case Study 4 investigates the effectiveness of foot reflexology on anxiety and physiological parameters in patients after coronary artery bypass graft surgery. Coronary artery disease is one of the leading causes of mortality worldwide. It is caused from a buildup of plaque in the arteries, causing them to narrow and restrict blood flow to the heart. Among several treatments, coronary artery bypass graft surgery has become the standard treatment for most critical cases. Although there are many advantages of this treatment, evidence shows that in conjunction with the diagnosis of coronary artery disease, the need for coronary artery bypass graft surgery stimulates anxiety in patients, increasing indices such as blood pressure, heart rate, and respiratory rate. In the study, 30 patients were divided into 3 groups: an intervention group who received foot reflexology, a placebo group who received general heel massages, and a control group who received neither. The FACES anxiety scale was used for collecting anxiety data of patients undergoing mechanical ventilation. In addition, the study also used a short form of state trait anxiety inventory. Findings showed that foot reflexology had a statistically significant effect on the level of anxiety and physiological parameters. However, it had no effect on heart rate. The short-term STAI indicated the lowest mean score was obtained in the intervention group. Although the researchers stated that all groups experienced a reduction in the level of anxiety, this was due to pain reduction, progress in improvement, and healing. Overall, the greatest improvement was seen in the intervention group.
For consumers, the non-intrusive nature of foot reflexology is preferred to mitigate the long-term effects associated with polypharmaceuticals. A randomized control trial showcased that foot reflexology was subsequent in a significant decrease in premenstrual symptoms than placebo counterparts. Further studies have shown that relaxation therapy significantly reduce psychophysiological stress associated with premenstrual symptoms. So ultimately, consumers have responded positively to foot reflexology as a relaxation aspect plus aid symptoms which derive from polypharmaceutical use. Various studies have indicated that foot reflexology complements critical treatments such as chemotherapy and cardiac angiograms, as they help relieve anxiety which would otherwise complicate treatments. Coronary artery disease is a prevailing chronic illness which requires angiography for diagnostic purposes. However, a study has shown that 82% of patients exhibit stress and anxiety, which subsequently affects diagnostic testing. Patients are more inclined to positively respond to foot reflexology as it provides comfort and improves their emotional well-being as they undergo critical life treatments. Since this therapy is used to complement evidence-based treatments and does not actually replace it, medical providers still provide optimal healthcare for their patients. Hence, as they receive treatments, foot reflexology parallelly comforts patients by improving their emotional and mental well-being while they undergo life-changing treatments. Ultimately, foot reflexology is a complementary therapy dating back millennia. Areas of the foot reflect to certain visceral regions, and by massaging these areas, patients are relieved of ailments affecting corresponding bodily regions. Consumers use foot reflexology to placate anxiety and distress while undergoing life-changing treatments such as chemotherapy and coronary artery graft bypass surgery. While it provides the relaxation effects to patients and emotionally comforts them, the therapy lacks evidentiary support for clinical use.